everybody, it is Matt and Dyan, and welcome back to Ok Aussie late night edition on Friday the 8th of November. It's currently 11:05. Was watching a bit of the old Star Trek as we're trying to get Dyan off to sleep, and as you can see she's not doing too well. Now, what actually is she doing? That's always a good question. We have been having some dystonic seizures. Now, we had them last night quite considerably for a lengthy period of time. That's where we then had a fire alarm also go off at the same time. Now, I don't see or expect that a fire alarm is going to go off tonight, but hey, let's touch wood, that's not going to happen here. Now, I've given Dyan some additional medication that she needs to kick in and see if this is going to start to ease it. We're getting a lot of tick sensation, a lot of motor movement, as you can see, through the legs. Cognitively struggling just to try and communicate and get information through. You've got a lot of pain going through the quadriceps and hamstring muscle groups on both legs. I know pain absolutely sucks. It really does, sadly. Not much fun for the poor thing. Now, if you're new to the channel, welcome. Dyan does have this chromosomal disorder called 22q11.2 Deletion Syndrome, known by many other names, cardiofascial syndrome, DeGeorge, Catch-22, whole range of different terms, but it does go by the designated 22q because it actually affects the 22nd chromosome. It's a microdeletion of that in the long arm, and it affects about 40 to 60 genes. So genetically, DNA block, we're having a few things happening. Now, Dyan's not very good at communicating during these types of seizures. You have a range of different seizures that come with 22q. Tonic-clonic seizures are the ones that we don't like. They're the worst case. Oh, it is. It's dystonic, honey. You've had dystonic posturing. Dystonia is where you're getting contorted, weird posturing and muscle aches and pains that go with that. Things lock into place, or we have things like this motoring of the legs that actually occur. Dyan can have cranial dystonia in the face, where we have segmented dystonia, different parts of the face can operate. She's had a lot of pain. Some of the early indicators for this today have actually been she did have some nausea. That's an early indicator. Sleep disturbances. Well, last night, like I said, having a fire alarm didn't really help the sleep, does it? No, it doesn't. Okay. Other types of seizures she gets, myoclonus, absent, and she's been having quite a lot of absent seizures. Mood orientation wise, she's also been affected, and that's coming through with the Tourette's. And all of these cognitive things are all in that same basket for Dyan. So it's not a good Friday night. I'm hoping that the medication is going to kick in very shortly and she's going to ease off and we can get some sleep for her, because sleep is obviously going to be her best defense to protect her in how she's actually feeling at the moment. I know, Bubba. These muscle contractions from dystonia are actually damn painful. Some of the contractions can hold into position, and to try and unravel them, not a good thing. So we've got to be very careful, particularly with a person who's got hypermobility. So that's the Ehlers-Danlos side of this condition. 22q, about 180, 185 different components and symptoms across the body wide that can be affected. So Dyan does have autism, ADHD, OCD, the Tourette side, multiple different seizures, GI tract related issues, hypermobility, spinal issues, scoliosis, a whole range of things going on, autoimmune compromised, you name it, respiratory, cardiac. Not a fun thing at all, poor bugger. Now, I'm hoping that the muscle relaxants that I've given her are going to be sufficient. I'm not going to have to apply an emergency medication, but you can see just how unsettling this is as she tries to get herself comfortable. And of course, I'm conscious that she doesn't want to hit or bang herself in any shape or form. Hey, boo, how are we going over here? Commonly, these things can happen in the face, and that's what we keep an eye on with the cranial distortion. That might cause things like the blepharism of the eyes, bruxism, grinding of the teeth, different engagements of the muscles in the jaw, transmedial joint, a whole range of things. Oh, sweetie. At least you're a little bit cognizant, which is really good. We're not getting syncope where she's passing in and out, and she knows that I'm here. But you're not winning, sweetie. I know. The pain sucks at the moment. I get that. Did you want some pain relief medication? I can give you some Panadol Osteo or Nurofen. I can give you some gabapentin. No. Oh, sweetie. You're doing so well. It has been a long day, unfortunately. You are trying so hard, kitten. I absolutely get it. I'm just glad that he's not going into tonic-clonic seizures, but that's why I'm obviously on high alert at the moment. Yesterday, as I was saying, we had like a DEFCON 4. We use that sort of scale up to DEFCON 5 to look at the predictability, the risk factor of her having seizures. I was driving only yesterday in the afternoon on the way to Kmart, and she was literally having dystonic posturing. She was then having cardiac issues where she needed to use a GTN spray. And with that, that's normally the indicators that early on that we might be having a seizure in the car. So that was very concerning just to get her out and about. Here, at least, she's safe in home. I've got all the medications and the equipment I need to keep a good close eye on her during all this. Oh, I know, Bubba, it's so difficult. Try not to hurt yourself, okay? I really don't need you exerting yourself, tearing a muscle, or dislocating. Dislocations, subluxations of joints happen a heck of a lot with seizures, particularly with ballistic movements such as tics. So from between Tourette's itself, myoclonus jerks, and then of course tonic-clonics, where you have got no control over rhythm, we can get contusions, which are bruisings, we can get scrapes, we can get subluxations and dislocations occurring. None of it's good. All this is uncontrollable movement, so I've got to actually balance between supporting her, protecting her, and making sure she doesn't injure or hurt herself. Oh, sweetie, it's not hot at all. It's actually very cool. Current temperature in the room is a consistent 23.4 degrees. External temperature at the moment is 17 degrees. It's meant to be dropping down to 13 degrees Celsius here in Perth, Western Australia. Current time is 11:12 p.m. Oh, sweetie, you're doing so well. I know, the pain is ridiculous. I can jump in. Okay, good. So we don't have a febrile temperature, it's only at 36.8, so that's cool. I'm happy for that. All this motor movement, of course, is going to accelerate the heart rate and blood pressure. Now, the stress last night, obviously, of having a fire alarm situation didn't help things at all. Dealing with some of the noise and dramas around the house. There's a foot. What's wrong? Which part? Okay, this group of muscle, yeah. Dyan's patella was dislocated yesterday and last night, and that's again quite a common thing with 22Qs having dislocation subluxations, particularly with the patella, interesting enough. We've been trying to also protect the neck with CCI, craniocervical instability, so she has injuries pertaining around to the neck. Getting a lot of facial movements, which again comes quite commonly with the dystonic action. And I'm getting this foot that's just constantly moving, not stopping. Okay, bruxism is where we've got the grimacing, grinding of the teeth. Whole range of motor movements happening. What can I help you with first? You have too many body parts. I don't know where to start. Alright. Okay, boo-boo. The muscle relaxant medication I've got will be starting to kick in. Let's try some pressure. I can go hard, can I? Go hard to go home. Well, we are home. Yeah, I know. I get that. Now, we record all of these sessions, episodes, things that occur for our clinical team. Dyan is under 20 different specialists, lots of ologists at her primary hospital where everything is centralised for her care. Headache, have you? Yeah, you can see the unbalance of the eyes. The left eye is more open than the right. We're getting some movement across some of the different facial muscles, fibrillations which are occurring, and pain in the head. Neurology. Oh, don't do that. I don't want you hurting yourself. It's alright. It's alright. I know. Now, there's a balancing point where I will throw additional medication into the mix, but I'm trying to avoid doing that too soon. I'm hoping that the medications that I've already get, the ASMs, anti-seizure medications, will assist in this instance. Hopefully they're also enough to keep us away from going into tonic-clonic seizure sets. We don't need to have a storm of seizures or status epilepticus, which is rolling seizures. I'm quite happy just to deal with the dystonia, but every one of these conditions, have all got their own separate challenges. Keeping an eye on her so that she doesn't hurt herself, bruise, like I said, or dislocate or sublux, or tear muscles, particularly with dystonia, when you're actually locked into weird positions, it can cause quite a lot of muscle tears, stress and strain on the ligaments and tendons that are supporting the joint structures. And there's already a collagen and a connective tissue disorder with the Ehlers-Danlos hypermobility, and Dyan is very, very super flexible. She was a dancer all her way through and a dancing teacher, so she has got that background of hypermobility. She's a 7 out of 7 on the flexibility testing. What can I help you with first? I don't know. Now, there's no easy trick or anything to the solution. Sometimes with dystonia in certain areas, like focal dystonia. See. Good, your eyes are open. Thank God for that. Can you see me? Kind of. I'm just a blur to you. Yeah. Cognitively, it's good that she's engaging with me. She's communicating with me. She's able to recognise me. She's able to touch me without waking me. That's good. It's alright. Just relax. Just chill. Miss Fuzzy, fuzzy. Fuzzy wuzzy, eh? Fuzzy. Yeah, I get that. All your eyelid ocular muscles are engaged, and that's going to affect your vision, your distancing, vectoring in as well, so it's not going to be very easy for you. You poor little thing. Hey? I pulled my back. You pulled your back muscles out? My back out. Okay, well let me try and help that as well. Now normally I try and keep Dyan, where? Yeah. Here, okay. Mid-thoracic, okay. Normally I try and keep Dyan flat on her back so that she's not on her side. There's more risk of injury in doing things whilst we're on her side. However, when she's going into tonic-clonic types of seizures, we might need to keep her in a recovery position on the side, simply for clearing airway. We don't want aspiration, choking. What's this roly-poly that you're doing? Where is your brain going for me tonight, Boo? We've noticed a build-up over the last couple of days of mood changes, a lot more frustration, aggravation that's going on. That's also tied into, like I said, the Tourette's, the uncontrollable nature of the vocal tic action. Physical tics we've got no control over. Commonly we may see things like the copulalia increase, which is the use of inappropriate language and referencing. Again, she has no control over that, so my apologies if it does offend. But that's part of the neurological condition that we're dealing with here. We've got pursing of the lips and different facial distortions that are occurring. So frustrating, isn't it? Some things are starting to relax, I've noticed, which is really good. The whole motoring part of the legs is starting to settle down. So I'm hoping some of the medication I've given, the ASMs, as I was saying, the anti-seizure medications, first level, have been enough to actually get in front of things and start to relax. My eyes off. You turned your eyes off, did it? Okay. It's okay. They don't need to work. It's night time. Your eyes need to go to sleep. So you can close your eyes. It's alright. You're safe. I'm here. I'm your eyes for you. Alright? There's an interesting crossover between stimulatory behaviour, stimming, which you'll see in autistics, Dyan's autistic, Tourette's activity as far as tics, myoclonus, which is random jerks and movement, and then the dystonic actions. We've got a real hot pot combination of neurological things going on simultaneously. Just relax. You're doing so well. Medications I'm giving you are going to help relax your body. You're safe. I've got an eyes on you. Now we've got the semi-3 seizure camera, which is constantly watching Dyan, also recording. I can set that up for alerts so you can trigger me. Obviously I'm right next to Dyan as we go along. You can see some of the distorted facial posturing that happens with this condition as well. Now, I haven't put a pulse oximeter on because I wasn't expecting this to go into full tonic-clonic seizures, so I wasn't needing to actually keep an eye on both oxygenization as well as heart rate during this. there's going to be an elevation of both of those elements, at least up by 20 points in each area, but not enough for me to be concerned. If there's some sort of respiratory distress, then I'll be putting the pulse oximeter on so that I could obviously manage airway and monitor stat results. Just hoping that what I've done here is just be able to relax her enough so that she can start to calm it all down and let her body relax. So all these things we measure as triggers, and they're also part of the bigger picture of things. Like I said, we're on a higher level of risk alert, particularly with the GI tract related issues, the medications that have been used around that. When we've got the combinations of sleep disturbances or lack of sleep, when the stress levels are heightened, when the physical energy has been burnt more, so we've utilised more of her energy capacity, her spoons, when the pain thresholds are also higher. All of these things, when the electrolyte imbalances are occurring. Now we've had additional use of frutamide today. That changes the whole electrolyte levels for Dyan. We've been utilising pressure care stockings to actually try and squish that out and reduce that. Doing a lot of things, but some things, the balance, if you get it just a little bit wrong in one area, it affects obviously another. It has a snowball consequence and effect to it all. That's sweetie, you're doing so well. You're starting to relax. Your body's slowing down. It's okay. Now, we've obviously been collecting this for the clinical team over a number of years. Dyan's been having seizures probably about 13 plus years ago. Hundreds, probably in the scheme of about 700 tonic-clonic seizures. Myoclonus, we just don't even bother counting anymore. It's regular sort of episodes of those. Absence seizures have been very noted over the last couple of days. Absence seizures are very short duration, anywhere between 3 to about 8 seconds. It's like the brain's just going through a little reboot and connecting back on. And there's those little brief lapses of time where she's not aware. It's literally like she's frozen. You wouldn't know that anything's happening. She's not talking, engaging, moving. And then suddenly she just keeps going. But she's missed out on that little segment of that time, that little lapse. And so if you're watching a TV show, she might go, did I just miss something? What was happening there? So that sometimes can be your early indicators. Obviously, when we're doing a lot of the camera work around us, we can capture these things as they're occurring. Even last night, as she was having another set of these, so it's been 2 nights in a row of these happening, particularly around the fire alarm. Even during the fire alarm, she actually fell asleep during the middle set of the fire alarm. She actually went out outside, because the fire alarm was around midnight, into the community, and she was having some absence seizures while she was engaging other people. It's so difficult dealing with all of these conditions, whilst also trying to keep her safe, whilst also just trying to manage everything. You're doing really well. Good. I can see a lot of strain still around muscles that are engaged in the masseter muscle here. Just relax. Your jaw's slightly distorted, not a normal position, but again, that's all of these same sort of positioning that we get with it all. It's going to stop. It's all going to start to relax. I can feel that most of your muscles in your leg have actually started to relax now, which is really good. It's going to start to ease off through the rest of your body. Having the tactile for me allows me to actually feel the discharge of electricity where the muscles are actually engaging, and particularly if they're quivering or fibrillating. And this was the thing, like last night, I was feeling and following the different sets of seizures as they're actually going through her body. Relax your hand. I know you bumped it just then. It's okay. Sorry. Don't be sorry. I'm sorry that you hurt yourself. Keeping a close eye on your person to make sure that she doesn't hurt herself in this is really important. I know, but you'll feel it tomorrow. You've got a nice little bruise on your inside of your palm from the one from last night as well. You hit the side. Yeah, exactly. Don't do that now, though. It's okay. Yeah, it's okay for the moment. We'll find out tomorrow if you've got another bruise. Feel it. Yeah. Sometimes with these type of seizures, a bit like the tonic-clonic seizure, she may bite the inside of her cheek, lungs, or tips, so we've got to be careful with that as well. It's really weird how the brain behaves in these moments. It's not only is it offline or disconnected, discombobulated really. There's sometimes regression, sometimes it will bring elements from the past, sometimes there's the echolalia, that parroting of sounds or noises, sometimes it's stimulatory type behaviour, which is what I guess we're seeing here, but then a lot of it's also combined with tics. Not normal movements, not normal actions, not things that she would want to do, naturally want to do, or feel like doing, out of her control. So there are a lot of challenges with a chromosomal disorder, rare diseases like 22q, and Dyan's got a compilation of several different types of rare diseases. She's the rare Pokemon card. You're doing really well, baby. Yeah. You've got your Hello Kitty pajamas on your Hello Kitty sheets. My God, I've done well coordinating her today. Hey? I get an A+ for coordination. Sarah, relax. Just a quick check of your pulse. It's currently 11:26 p.m. Heart rate started to slow down nicely.
I love cats.
Yeah, heart rate's at about 60, 65 beats per minute at the moment. Coming back down to her baseline, which would be more around 52, 55. Yeah, so you're starting to relax your body, which is good. I like that as well. Alright. Well, look, it was a quick little touch base as we're going through this Dystonic Storm episode. It's not fun, it's not comfortable. I don't know if any of these things from a neurological perspective are fun or comfortable to be in. There's a lot of frustration when you lose that ability to control. There's that fear of it coming on as it feels like surging in waves of it coming through you and losing the control. There's the injuries that come with it, and of course the recovery phase. Hopefully she'll get a good night's sleep after all of this. She'll feel really exhausted and they'll add to it. Oh, baby. Relax your jaw. Just relax. I don't want you to bite your tongue by mistake or cheek, okay? Yeah, I know. I can see. You're doing really well. Yeah, darling. It's okay. Sore muscle, yeah? Okay. You got sore everything at the moment, haven't you? Yeah. I can give you some extra medication if you like. Do I try that? No. Dyan's very resistive about medication. Sometimes that's part of my challenge, is also the intervention and knowing what to give and when to give it. Are you an Indian? My goodness me. You are so funny at times. With interoception for autistics, it's quite difficult to know the internal states. Pain, thirst, hunger. Okay, very, very difficult at the best of times. These sort of things that we're going through must be so exhausting, what the brain is sending signals, nerve impulses, actions to actually do. It's almost like she's playing the piano. It's okay. It will stop. You've got one eye fully closed, one eye, left eye slightly open. Your vision will be clouded. Here it is, your left eye. It's okay. It's okay. It's only shadows. It's alright. Not a problem at all. And it's very disorientating. Not only is it disheartening, so it can actually be quite scary being the person going through it. So it's important to keep things calm, to be the eyes for her and have the reassurance. Also know when to step in, when to intervene with medications. I know you are. Oh, I do love your Hello Kitty though. I think that was a good choice for tonight. Hello Kitty. Hello.
Hello Kitty.
Yeah. It's a nice one. It's a nice summer set. As we are starting to get into the warmer weather, aren't we? Which blanket did you choose there? Was that your Care Bear one? You got Care Bear blankets. Okay. Doing really well. Well, guys, I hope you have a good evening and a good weekend. This is part of our challenge. I must admit, I'm at burnout. I'm really tired. I'm really exhausted. And have been for days. I mean, last night's fire alarm
I'm hungry.
didn't help. Well, that's good. I'm glad you're hungry.
Yeah.
I think you're coming out of this situation. You'll probably have a bit of food and then you might go to sleep. How about we do one of the hospital shakes?
No.
No? Do you want some chocolate?
Star Trek.
How's Star Trek going to help you? Okay, at the moment we've got Star Trek up there, which I'm trying to get back to watching. And she's actually organised a Star Trek t-shirt to order, which is coming, by the way. I got the order tracking information. It's on its way from the UK. It'll be here in about a week and a half's time, I think.
Okay.
That's cool. She's become a bit of a fan of Star Trek, which is nice. Bit of a retro view. You've been a fan since you're little, but shh, don't tell anybody. Alright, I'm going to get you some food and we'll wrap up here as well. Guys, thank you as always for being around and staying with us as we go through this. Sharing Dyan's journey with a complex, chronic, chromosomal disorder and all the umbrella conditions that go underneath those. Dealing with the neurology as a patient and also as a caregiver, guardian and partner. I've been with Dyan for about 34 years now, so I know her inside and out. And it has become more and more challenging, definitely over the last decade, particularly with all these intense, increasing neurological conditions. It's a bit scary when you see you're losing your person, when you've had to resuscitate her, when you've got your life in her hands. It's not that easy, and it's disappointing to see the hurt, the pain, the suffering that they go through as well. So I'm here for you. I'm going to keep you nice and safe and relaxed. Don't hurt your cheeks, okay?
Ow.
I know. What I don't want you to do is don't do that. We'll get you some food. Give Dyan a big thumbs up of encouragement. She'll get through tonight and feel better with a good night's sleep. If you have comments, questions, ideas or suggestions, leave them below. And as usual, if you haven't subscribed, please do. Hit that notification bell and we'll see you in another episode real soon. Good night, guys. Bye for now.